Good morning, everyone. My name is Anita Lynch, and my research is about reclaiming sexual empowerment after surviving childhood sexual abuse from the perspective of therapists in private practice in Ireland. According to research published over the past 10 years, more than any other type of childhood trauma, childhood sexual abuse is believed to have an impact on an adult's sexual health, is linked to greater sexual dysfunction, lower sexual satisfaction, as well as higher degrees of sexual compulsivity and sexual risky behaviours. The most challenging aspect of healing from trauma may be reclaiming a stolen body, as the wound won't mend on its own. Survivors were discovered to be more inclined to view their bodies as a source of suffering as opposed to a source of sexual pleasure. The desire for sexual pleasure is likely to be suppressed by feelings of shame, and intimacy issues are more likely to be closely related to the abuse. The effects of childhood sexual abuse on adult sexuality and sexual dysfunction is well documented. However, after extensive literature review, I discovered a gap in the research. There is no literature on reclaiming sexual empowerment after surviving childhood sexual abuse through the lens of therapists in an Irish therapeutic setting. In Ireland, the SAVA report revealed that 30% of women and 24% of men experienced some form of sexual abuse before the age of 17. Statistics for Counselling from 1 in 4, a charity that provides counselling to adult survivors of childhood sexual abuse, show that nearly 20% of presentations were for religious and clerical abuse, and nearly 35% were for familial and ex-familial abuse. The objectives of this study was to gain an understanding of how childhood sexual abuse impacts survivors' sexuality, uncover what are the barriers and benefits for survivors and therapists in reclaiming sexual empowerment, and if this was important and meaningful for survivors to do. This is a qualitative piece of research using interpretive phenomenological analysis, IPA, to develop an understanding of how people experience significant life events by examining how people make meaning of their life experiences. Semi-structured interviews consisting of 10 questions formulated from my objectives were conducted over Zoom, lasting on average between 25 and 45 minutes each. These were then transcribed and color-coded in terms of the themes that emerged. 6 participants volunteered after advertising across multiple social media platforms. They were all Irish, all women, 5 married, 1 divorced, and all had children of various ages from primary to secondary school. 1 shared that they were practicing a year and a half, and the other 5 stated they were practicing between 10 to 17 years. They were all working in private practice, and they were all providing counselling to survivors of childhood sexual abuse as per my inclusion criteria. A variety of modalities were represented in this sample. Most interestingly, 3 participants disclosed being survivors of childhood sexual abuse. 2 participants did not disclose either way, but stated they specialise in this area, and 1 participant disclosed having no history of childhood sexual abuse. All participants were asked to define their concept of childhood sexual abuse, sexuality, and sexual empowerment. They all gave similar descriptions. However, I chose this particular response to childhood sexual abuse to share with you all today. I identified 5 themes. The first theme was their response to being asked the question, if childhood sexual abuse impacts a client's sexuality, and I talked about the differences that came from that. And the 5th theme was about being asked if reclaiming sexual empowerment was important to clients, to which they all responded absolutely. Now, these questions were in line with my objectives, but for the purpose of today's presentation, I'm going to talk about the 3 themes that emerged in relation to barriers. Theme 2, the Irish culture, and within that there were 3 sub-themes. All participants expressed their belief that childhood sexual abuse is still a taboo subject for the majority of Irish people. 4 participants discussed how growing up under the influence of the Catholic Church led to oppression and shame about sex and sexuality. 5 other participants stated Irish people are not at all comfortable about talking about sex. Up until the 1960s, most Irish people had a comprehensive set of rules for behaviour and thought dictated by the Catholic Church. One theory for why counselling wasn't widely known until the 70s and 80s is the impact of religion. However, Irish attitudes on sex, religion, emotional expression, and authority have drastically changed more recently as a result of modernism's influence in this country, and these topics are crucial for counselling. Theme 3, the Irish therapist, and within that there was 3 sub-themes. One of the strongest themes to emerge was about the Irish therapist, in terms of not being comfortable to talk about sex or childhood sexual abuse, and their inexperienced fears, bias and judgments when counselling clients. The discussion of sexual themes by clients can be difficult for therapists, as noted by all participants. Their discomfort with these issues, which is frequently accompanied by a lack of adequate clinical training regarding sexual topics, may lead to an avoidance behaviour that manifests as implicit signals to their clients that sexual matters simply don't need to be discussed in therapy to any great extent. One participant shared a client experienced horrific childhood sexual abuse by his mother, and when he went to a counsellor and disclosed what had happened, the counsellor said, "Mothers don't do that to their sons." So he left and never went back until he was in his 30s. Theme 4, the Irish training, and within that there's 2 sub-themes. All participants voiced their concerns about the lack of training in Ireland on childhood sexual abuse and sexuality in their primary and master degrees, with some optioning for specialised training or going abroad for further training. 2 participants disclosed different experiences of attending the Rape Crisis Centre for training, one positive, which is on the screen, and one negative, where she stated it was lacking. One participant went to the UK for psychosexual training, stating it's not available here in Ireland. This is also well documented in the literature. While most therapists report some formal exposure during training and in internship, this training is frequently shallow and focuses more on sexual difficulties rather than good sexual functioning. This has immediate clinical ramifications for how comfortable and capable therapists are to treat sexual content. The findings provided rich insight into the barriers Irish therapists experience when working with sexually abused clients on reclaiming sexual empowerment. Only a small number of authors have written directly about the challenges faced by counsellors working with this demographic, despite the possibility that counsellors will encounter sexual abuse survivors. The specifics of the abuse, particularly those involving violent, sadistic, or unpleasant acts, are much more horrifying. It follows that the aspects of sexual abuse that survivors need to express and process the most are also the ones that make the counsellor feel the most uncomfortable. Although asking directly about the abuse can be stressful for many survivors, doing so is a necessary step in treatment because it breaks the cycle of denial and secrecy and allows for discussion about the unpleasant feelings of shame and guilt that follows abuse. To properly address the wide-ranging impacts of sexual abuse, counsellors must not only obtain specialised education, training and supervision, but they must also become conscious of their own reactions while working with this population. For meaningful change to happen, both the therapist and the client must be aware that this process requires time, effort, patience, and most importantly, compassion. The sample size of this research can be seen as a limitation, as only 6 participants took part. Most of the literature refers to female survivors, and only female therapists presented to take part in the interviews. Unfortunately, not having a male voice in the interviews is a limitation. The bias of the researcher needs to be acknowledged, as I am a survivor of childhood sexual abuse. However, a strength of this research is 3 of the 6 participants disclosed being survivors of childhood sexual abuse, giving rich insight from both aspects of survivor and therapist combined. A special thanks to all my participants for their time and sharing their perspectives. A huge thanks to my fellow student Sandra for the past 2 years for her sense of humour and motivation to keep me going. My lecturer, Dr. Noel O'Connor, my supervisor, Jade Bardon. This research is dedicated to my great aunt Peggy, who endured horrific familial childhood sexual abuse. She came from a generation of people that don't talk about it, and she died from vaginal cancer, having never experienced an intimate relationship. May my ancestors of childhood sexual abuse be at peace from their unspoken wounds. And thanks for listening.